As if we didn't hate stress, trauma, and narcissistic abuse enough, did you know that it can actually contribute to gum disease? Hi, my name is Strawson, and I'm a trauma-trained somatic practitioner and your host of Trauma and Narcissism Redefined, your weekly dose of education, inspiration, a bit of humour, and to really help you survive and thrive after trauma, and for those of you who've experienced abusive relationships. Now, in today's episode, I want to talk to you about something really personal, actually, and it's been my own journey. And I've done another podcast on chronic illnesses that can be caused when you've experienced trauma, because we have a heightened amount of cortisol in our body, which leads to inflammation. And for me, that led to me being diagnosed with irritable bowel syndrome, non-alcoholic fatty liver disease, and I did actually have a heart condition called long QT syndrome that I was diagnosed with. I was on no medication for that. But of course, you can imagine having all of that was quite a worry. Now, I have completely reversed all three of those diagnoses. I no longer have a heart condition, I no longer have IBS, and I no longer have non-alcoholic fatty liver disease. And that was due to a lot of somatic healing, so a lot of nervous system stuff. You know, time alone doesn't just heal trauma, mindset work doesn't just heal trauma. The thing that really worked for me, and the thing that I talk about and why I completely retrained from a podiatrist into doing what I'm doing, was somatic healing, the nervous system work. You know, you don't think anxiety, you don't think depression, you feel it. So we have to feel to heal. We have to literally complete survival responses that get stuck in any given moments so that we can almost timestamp them in our brain into the past, not like they're still happening in the present moment. But there was one that I did not know. And this is why I want to share this journey with you, in the hope that maybe you can relate. Maybe you already knew this, or maybe now you're going to connect the dots in this podcast. And equally, if you didn't realize this, to go and get this checked. It's really, really important. So probably about 6 weeks ago, I thought, you know what, I'm going to go to the dentist. I have this big fear of the dentist. I had two really bad experiences when I was younger. So when I was a child, the dentist that I had ended up being in prison, because back then, if you had a tooth out or anything and you had laughing gas, so nitrous oxide, you had to have a dental nurse present. And my dentist at the time didn't. And sadly, the lady that he was doing an extraction on, she passed away. So we actually ended up going to prison at the time. So you can imagine me as a child, that was already like, oh my goodness. Then when I was about 24 years old, I joined a company to travel for a while, and I needed to get a filling. And when I went to see a local dentist, he left me waiting for a couple of hours. So I was sat there already quite nervous, because maybe like me, you're nervous of the dentist. And when he arrived and he proceeded to put a filling into my tooth, he was really rough. And I remember the dental nurse was there. I'd got tears streaming down my face, and she was going, "It's okay." And I was going like this, like I'd got some of that amalgam stuck in my throat, and he was saying, "Just stay still." Like really, really aggressive and rude. And I remember coming out, tears streaming down my face, and going back to my mum, because my mum was the one that actually had said, "Oh, there's a dentist there." And of course, I'd got anaesthetic in my mouth, and I said to my mum, "That dentist, I'm never going back there again," because I couldn't speak properly because of the anaesthetic. And my mum literally said to me, "Oh, he has a bit of a reputation of being a drunk." And I was like, "What? Why did you not tell me?" So from that point on, no word of a lie, for probably 25 years, and I'm not underestimating here, I didn't go to a dentist at all. Now, with my children, regimented. We go every 6 months. But myself, I became meticulous in the oral hygiene. Like literally, I clean my teeth when I should. I floss. I use a non-alcoholic mouthwash. I am meticulous in looking after my teeth. Teeth are really, really important to me. So didn't bother going to the dentist for 25 years. Then probably around 3 years ago, I thought, you know what, I really should go. And my kids had been going to a fantastic local private dentist where I live. And I thought, you know what, I'm going to make an appointment and go. And when I went, I was very vocal of, this is scary to me. And again, the work that I do, totally irrational fear. But there is something about the dentist that above everything else, I'd rather do anything else than go to the dentist, like literally anything else. I'd rather go and hang out with my ex-husband on holiday for a week than go to the dentist. That is how much I do not like going to the dentist. I did say there was some humor involved. So I went to see this dentist who was amazing. I didn't need any fillings, but they did say, let's book you in to see the hygienist, which was great. Saw an amazing hygienist there. She gave me a bit of a local anaesthetic to do that and gave me a good old clean. All good to go, right? Anyway, 3 years had passed and here I am as a 51-year-old woman now. And I thought, do you know what? I quite fancy maybe looking at Invisalign. I've got on my bottom teeth, as my wisdom, I've got a big mouth. You guys all know that, don't you? Whether you're listening to this now or you go and watch me on YouTube or Reels, I've got a big mouth and big teeth, okay? And even when my wisdom teeth came through, I could probably fit another 4 teeth in my mouth. Like literally, I probably could. So when my wisdom teeth did come through, it did start to push my teeth, particularly on the bottom set, a little bit forward. So I have some slight splaying with my bottom teeth. And I thought, do you know what? There's a particular dentist near where I live. It's a national dentist. And I thought they talked about doing Invisalign only on a bottom set. So I thought, great, that would work well for me because obviously I do a lot of speaking, a lot of camera work, and that would work really well rather than having top and bottom, because I know sometimes they do both to adjust the bite. But my top teeth are really, really straight and I've never had braces. I'm very blessed with my teeth actually. And we are in our family, we've got very strong teeth. So go in and I thought, do you know what, I'm going to talk to them about teeth whitening as well and just have a little bit of a chat. But I knew, and I'd probably been thinking about it for 6 months to be fair, but I also knew they'd have to do a checkup. And that was what was putting me off. I almost wanted to go in and go, yes, here's the Invisalign, yes, here's the whitening. We won't check anything else, which of course is ludicrous, isn't it? So in I go, get everything checked, don't need any fillings. But they then took an x-ray. And this is where I want you to listen up carefully because you may already relate to this or you may not have known, and you need to know this because no one tells you this. So I had this x-ray and what came back was a 30% bone loss and moderate gum disease and severe right where my wisdom teeth are as well. Now you can imagine the person with a fear of dentists. I was like, oh my goodness. And I was like, I'm not going to lose my teeth, am I? First question. Answer was no. You know, this is early enough. But what we will need to happen is a regimen. So I needed to book in 3 appointments. 1 for the hygienist to clean the top level surface of my teeth. I was like, yeah, okay. And then 2 90-minute, yes, 2 90-minute appointments because I had to see a periodontist then. And I had to then have 2 90-minute appointments booked where they would give me a local anaesthetic for half my mouth on one session and then the other half on the other and go underneath my gums. Because what happens is obviously your teeth are in your bone and you've got these little pockets. And as you get gum disease, and the gums will inflame. This is maybe where you get bleeding gums and it opens up. And as hard as you try and clean, because I am meticulous, if you get little bits of bacteria that go down there, obviously they fester, they grow, they can attach to the lower part of the teeth and the dentine. And that starts to create a bigger pocket underneath and it starts to erode the gums. You get some gum recession and obviously it starts to actually eat into the bone as well. So whilst on the surface, I still look like I had great teeth. And you would not have known because I've got big teeth. But on the x-ray, and I could see it, you could see these pockets and you could see these little bits of plaque and calculus that were underneath the line I was never, ever, ever going to be able to clean. So I had to get those booked in. Oh my goodness me. Again, thank goodness I do nervous system work because my capacity was very, very full at that point. I was practicing what I preached. So as I'm recording this podcast right now, I've done 2. So I've seen the hygienist and I've done one side of my mouth. So I went in and they said, hi, it's Caroline Strawson. I'm here for my 5 o'clock appointment. Now you have to get there 15 minutes early. And they said to me, oh, we're running 20 minutes late. And I said, is that you being a generous 20 minutes late, or does that mean 20 minutes? Because I thought, oh my goodness, I'm going to have to sit here for 35 minutes now. And they said to me, and she kind of grinned and smiled at me. And I said, look, it's a really big deal for me to be here. If it's after 5:20, I won't be here. I said, because I literally, this is a really big deal. And she said, don't worry, I'll go and check. Anyway, it was only about 5 minutes late, actually, in the end. So I went in, and I have to say, Jazz, who was my dentist, my periodontist, and the amazing dental nurse, know me from my other appointment, and they were phenomenal. They were so good. And I had my anaesthetic in one side. Again, I was asking loads of questions about how's that going to feel. Needles, I could inject myself with an anaesthetic, but in my mouth and in that, that's when I'm doing my breathing. And of course, I'm a hypnotherapy trainer as well. So I'd already put myself into a trance-like state, and I'm very good at putting myself into that state so that I can get through all of this. The anaesthetic actually wasn't too bad. He said it might really hurt at the top part, but it was fine. Not a problem. I then got my noise cancelling earphones on, put those on, and I'm about halfway through listening to the podcast with Stephen Bartlett and Simon Cowell. So thank you, Simon. Thank you, Stephen. So I still have one more appointment to go, but you know what? Talk about exposure therapy. I'm feeling good. Now, the reason why I'm sharing all of this with you is in my very first appointment with Jazz, so the periodontist, he asked me, obviously, the usual questions about, am I a smoker, etc. And I'm not. I've never, ever smoked. So the usual things when we're thinking and talking about gum disease. And then he said to me, have you experienced stress or trauma? Now, of course, we all have to a point, right? All of us. However, I said to him, I told him the story, 10, 11 years ago, I went through a really horrible abusive divorce. I lost everything. My mum had passed away the year previously. So kind of, all this catalogue of stress. And he said, yep, that'll do it. And I was like, what? Now, I knew, because this is what I teach in my programs and my healing programs, I knew of something called bruxism, which is when you're in a fight-flight response and you tense your body, you can literally clamp down on your teeth like this. So I knew about clamping down on your teeth because many in my community actually wear retainers. So I knew about all of that. So I knew from a dental perspective, your teeth can be affected from trauma. But I'd never had that. But interestingly, and he said this is relatively new research that comes out as well, and I've been reading a lot on this too, and this is why I wanted to share it with you. And remember, I am no doctor as such. I'm a somatic practitioner, and I'm here talking about my own experiences. So if you're in any doubt, go and see your own healthcare provider, go and see your own dentist as well, but you need to see a periodontal specialist for this. So what he said, which makes perfect sense, is when you have that increase in cortisol, we know it leads to inflammation, right? Because we know it can cause chronic illness, things like autoimmune disorders. But it made total sense then that when you produce excess cortisol, your gums will also inflame. And then if you brush a little bit hard, and then that causes the bleeding, it's a portal for infection. And then bacteria can get into those pockets, and that can cause gum disease and obviously bone loss. And I was like, whoa, I had no idea about any of this. I did put a post out on Facebook the other day about it. And so many of you in my community said, you can relate to this, or you're going to get your butts down to the dentist and get an x-ray. Because please do so. You may look like you have great teeth on the surface, because maybe even like me, you're really meticulous. Or maybe you're not, because your oral hygiene has gone to pot because you're literally just in survival mode. But you need to be checking your gums. And there's a lot of research as well of gum disease in relation to cardiovascular disease, dementia, Alzheimer's. So it's really, really important. And I read some research that it said if you treat your gum disease, you can add an extra 6 to 7 years onto your life. So it is worth doing. And I really urge you, and I get it, for many of us, dentists can be really, really scary. And this has been a real learning curve for me. Not to leave things so long, because it may have looked good on the surface, but you don't know what's going on underneath. And I'm a big believer, because I do this a lot with my gut. I have a lot of gut testing, and I like to know what's going on. And there I was thinking my teeth actually were okay because they looked okay, but it was what was going on underneath. And the likelihood is that my gum disease was caused by the trauma of going through my divorce and an abusive relationship, the covert narcissist in my life. So this is why I'm sharing my journey. You know, all the things that I've been through, I love to share, because as a woman who's 51, and also menopause can make a difference. I'm through the other side now. So please be aware of all of this. It's really, really important. Please go and get your gums checked. And I would love to know if you can relate to any of this. Either drop me an email, a message on Instagram or Facebook. Let me know. And if you didn't know this and you end up going to the dentist and there's gum disease, do let me know and share it with other people. Share with people that stress and trauma and indeed narcissistic abuse, from my perspective, causes inflammation. So of course, if we brush a little bit too heavy-handed and it bleeds, yeah, there's the entry to portal for bacteria. So I hope this has been really, really informational and educational for you. You know, at the end of the day, we get one body and it's only down to us and our responsibility to look after it. So take care, my friends. Keep in touch. Let me know if this has been useful for you, and I will see you on the next episode.